Watch this video till the end to get complete guidance about how to approach dermatology in your MBBS. Welcome to Crack Dermatology DrMSD. Myself, Dr. Maddineni Srinivas, your dermatology faculty from Bharat. So I have completed my diploma in dermatology from JSS Mysore and DNB from Hindura Hospital. So with the experience of teaching students since 2015, I am making this video to guide, to give strategies on how to complete and cover dermatology, which is very important subject for NEET, INICET and also FMGE examination. So let's begin the video. Before this, I just want to give you a small information that of late the exams are asking questions which are little bit tough, more towards clinical side, and also you can see they are lengthy questions, just like USMLE asks the questions which are lengthy in nature. So this is the transformation which is happening in the exam pattern. So the PYQs, previous year questions, which were recently thought to be important, now the importance is shifting towards previous year topics, PYTs. So PYQs are important, but they are not sufficient. You have to cover, you have to know what are the PYTs. Before that, we should know what is the importance of dermatology in MBBS curriculum. So if you see these images, you can see that I have written dermatology as a cousin brother of medicine. Why I have written like this? If you see on the left hand side, the Fitzpatrick Dermatology in General Medicine textbook, this is also a standard book which we follow in our post graduation, and you can see it is mentioned that dermatology in general medicine. This was 8th edition, and you can see in the 9th edition it is changed to just Fitzpatrick's dermatology. So what I wanted to say in this is that this dermatology is a small branch which came out from the medicine, but now it is becoming a individual subject on its own. And if you can compare medicine and dermatology, we can think of medicine as Titanic ship, whereas dermatology is a Titan. I hope you have heard both of them. Both of them sank in the ocean and they are not present physically anymore. So I am just comparing the subjects, and this is not for telling something regarding the movies. So you can see medicine is Titanic, it is very vast subject, whereas dermatology is a small Titan, which was a submersible, and it also sank under the ocean recently. So what I want to say is, when compared to medicine, which is a vast subject, it is like a ocean. Okay, in the dermatology can be compared to a small river, and yet dermatology is very high scoring, high yielding subject. Why? Because less number of questions will be asked, like 5 to 10 questions will be asked, but high probability is there that you are going to make all of them correct. That is, there is approximately 90 to 100% possibility that you can make correct answers for all dermatology questions which are asked in any kind of examination. So that is the reason it is high scoring, and it is also image based. So if you have a visual memory of the images which you are seeing, either clinically in the OPDs or in the exams which are conducted as test and discussion, subject wise test, wherever you see in the OPD, whatever may be the way in which you are exposed to the images, but if you see the image of the patient and if you can remember the clinical features, then you can easily diagnose in the exam. Why? Because mainly clinical questions are being asked of late, and also revisions are very easy for MBBS students. Why? Because this is a PG predominant subject, dermatology. So most likely in MBBS you are going to see the basic concepts related to dermatology, but not in depth. So questions are also going to be superficial, not very in-depth. So you can read the subject very easily and also revise it in a short span of time, and you can also attempt maximum number of questions correct and get a good score. And one more thing you must remember, a picture is worth 1,000 words, 1,000 words. So what does this mean? I will show you this slide which is related to molluscum contagiosum, which is a viral infection. So you can see it is described as pearly white dome-shaped umbilicated papule over the face, where we can see pseudocombinous phenomenon. So this is a description which is given here. So instead of this description, if I will show you this image, then you can remember this image probably for a longer period of time. Why? Because you are able to see a papule, which is pearly white in color, and you are able to see a umbilication which is present at the center. And you can see there are also few more lesions which are present adjacent to this large lesion. So what is the significance of this? I will tell you in the next slides. But before that, I just want to again reinforce that this dermatology is very, very important visual memory based subject. So if you can remember the image, you can remember the description of the condition. So now coming to how to approach, how to answer the image based questions, which are the most important in dermatology when compared to other subjects. So you need to remember that there are three aspects which must be remembered, which you can remember with the help of this short memory aid, that is mnemonic. MCD, when I was doing my DMB, Mehta sir used to call it as Municipal Corporation of Delhi. What is MCD here? Morphology, configuration and distribution. So this is the Municipal Corporation of Delhi in dermatology. Morphology, configuration and distribution of the lesions. If you can remember, if you can identify these 3 points which are mentioned in the question along with the image, then you can easily diagnose a given condition. So what is a morphology? It simply means what is being shown in the image. What is configuration? Sometimes configuration can be also called as arrangement of the lesion. So instead of configuration, even arrangement you can remember. Arrangement. So how it is arranged. So this mnemonic you can also remember it as MAD also instead of MCD. So finally we have distribution. So where are these lesions located, and most importantly also you must remember what are the sites which are classically spared. So these are all the points with the help of which you can easily answer the image based question. So I will give you some examples related to this. So in the morphology, it is important to identify what lesions you are seeing, and in the dermatology, remember lesions are of 3 broad varieties: primary lesions, secondary lesions and special lesions. So these are all the primary skin lesions which you are going to read. They are very, very important. You can consider they are just like alphabets. They are like alphabets. So if you consider dermatology as a English subject, then these primary, secondary and special lesions can be considered to be alphabets. So if you do not know these, you cannot understand the clinical features. You cannot describe the lesions which we can see in various conditions, various diseases. So these are all the primary lesions: macule, patch, papule, plaque, nodule, vesicle, bulla, wheal, pustule, abscess. So, and these are the secondary lesions. What changes which can happen in the skin when the primary lesions are either treated or when the patient scratches those lesions. So these are all called as secondary skin lesions. Okay, and we have some special skin lesions. And if you wish that I should make a video on these lesions, please in the comment section type skin lesions. I will try to make a video and explain all these lesions. So finally, after knowing morphology, configuration, distribution about the terms, so I want to give you some examples and show you what is a holistic approach you must follow. Please remember, so if you're too focused on small details or parts, you might miss something big. So this is called as can't see the forest for the trees. What do I mean by this? If you look at this image, what you are able to see, these are the fluid filled vesicles which you are able to see. So that is the lesion which you have identified. Next thing is, what is the configuration? What is the configuration? So you are able to see that all these vesicles are present together, adjacent, very nearby. So this is called as grouped configuration, grouped arrangement. Okay, vesicles are arranged in cluster. And now coming to distribution, where are they distributed? They are present near the oral cavity, near the lips precisely. So if you see grouped vesicles which are present near the lips, you must think of herpes labialis. So that is how, this is how you can come to a conclusion when you see a image. So the same vesicles, the same grouping, if it is present in a dermatomal configuration or dermatomal arrangement, that is, if the vesicles are present in an area which is supplied by a single nerve, then our diagnosis is going to be herpes zoster, which is also called as shingles, which is caused by varicella zoster virus. So this is how knowing morphology, configuration, and distribution of the lesions is very important. And if you see in this image, even the areas which are spared is also important. So which are the areas which are spared here? Yes, apart from the dermatome which is supplied by this nerve, the rest of the dermatomes are spared. Okay, so not only the areas which are involved, but also areas which are spared are also important. Okay, and in the distribution you can see these three images. The first one is where a patient is having lesions predominantly in the flexor aspect, antecubital fossa. So probably this could be atopic dermatitis B3, that is niacin deficiency. So it is vitamin B3 or niacin deficiency, and this is called as Castle's necklace. This is called as Castle's necklace, and you are able to see that the eczematous changes are present in the photo-exposed area. And finally, in this picture, you are able to see that your scaly erythematous plaques are present predominantly over extensor surface. So most likely, this is a case of psoriasis. And with this, I want to tell you one more thing, that in psoriasis, you must examine nails. Also, you must examine hair. Okay, so if the patient is there, this is how you must approach. In the question, you should look for the nail changes and the hair changes which are mentioned by the examiner. Okay, this is the holistic approach with morphology, configuration, and distribution, which is going to help you answer the image-based questions in the examination. Okay, so next, in this image, I have told you just to remember that there is one more point related to pseudo-Koebner's phenomenon, where you are able to see this is the bigger lesion, and probably there was some trauma due to scratching, because of which these viral particles they have inoculated into this surrounding normal skin, producing what is called as pseudo-Koebner's or Koebner's phenomenon. Pseudo-Koebner's phenomenon. So this is the importance of holistic approach, with the help of which you can answer many questions by looking at the images. So coming to next aspect, dermatology is very interesting subject. Why is it very interesting? Because in the other subjects you are going to read and you are going to answer, but in dermatology most likely examiner will give you a image. So by looking at this image, you can get some more clues, and if you have a good visual memory, you can easily come to a final answer. And not only this, in the OPD, because this is a outpatient department, mainly dermatology. So look at the patients, diagnose and treat them. So this is what mainly dermatology as a core going to consist of. So if you have this knowledge, theoretical knowledge in dermatology, then it is going to help you clinically also. How it will help, I will tell you. But before that, dermatology is also an integrated subject. This is not separated from other subjects. So there are conditions like, for example, connective tissue disorders, certain infections, and also conditions where integration with pediatrics and dermatology does exist. So we'll see all this in the coming slides. So what I want to tell you is, you must target the high yield topics and previous year topics. If your target is this, then you are going to cover most of the dermatology and you are going to get very good score in your examinations. And this is the list of some of the very high yielding topics and previous year topics. You can pause this video at this point and you can take a screenshot and save these topics which are very important, high yield and previous year topics related to dermatology. And I am telling dermatology since the beginning of this video, but remember it is DVL, that is dermatology, venereology and leprology or leprosy. So related to dermatology, what you must know and what you must cover. So basics of dermatology, which are going to be certain terms which you must know, certain lesions which you must know, certain dermatopathological terms which you must know, some investigations which you have to know related to dermatology. So these are all under basics. Next, coming to diseases and certain drugs. So related to drugs, there are not many drugs. Some of them which you must remember are isotretinoin, acitretin, methotrexate. So these are the medications which we usually use in dermatological practice. So coming to basics, so these are some of the questions which I have framed. Yes, in the examination, even questions related to basics can be asked as clinical questions. But in this video, I'm just giving you the overview. So I have given it as one liner. So if you know the answers for these questions, please put your answers in the comments below. In the comments below, I will tell you the answers at the end of this video. So watch this till the end. Coming to the diseases, we have vesiculobullous disorders, which are extremely important for your examination, and there are acquired or immunobullous disorders in which we have pemphigus vulgaris and bullous pemphigoid, which are must-know topics for INICET examination, and MCQ is going to come from this topic. And also the congenital like mechanobullous disorders in which we have epidermolysis bullosa. Next, we have papillosquamous disorders in which there will be papules and there will be scaling. This is also a very, very important topic in which you can expect one question in your exams. We have psoriasis, lichen planus, and pityriasis rosea, topics which are important in this papillosquamous disorder. Keratinization disorders in which we have ichthyosis. Various types of ichthyosis are important to be known. And these are other diseases where we have integration with microbiology, pharmacology, and also medicine. So there are various infections. Like for example, we have bacterial infections, impetigo, erysipelas, cellulitis, necrotizing fasciitis, scrub typhus, and anthrax. And in the cutaneous tuberculosis, we have TBVC, scrofloderma, lupus vulgaris, and Buzzins disease. Fungal infections, we have pityriasis versicolor, various types of tinea, deep fungal infections, which are inoculation. The reason for them is inoculation. So implantation mycosis is the other term which is used, which are sporotrichosis, chromoblastomycosis, and mycetoma. And we have viral infections, herpes, human papillomavirus, molluscum contagiosum, coxsackie viral infections producing skin lesions, parasitic, like for example, the scabies, which you must know, and also Laus-borne conditions. And in the leprosy, which is also a type of infection, but it is having importance, so it is kept under DVL. L stands for leprosy. So related to this, you must know the causative agent, the Ridley-Joplin classification, the various types of leprosy like TT, BT, BB, BL, LL. You must also know the reactions, type 1 lepra reaction, type 2 lepra reaction, and the treatment of these conditions, and the chemoprophylaxis which we can use. The MDT, most likely it will be covered in your PSM as well. So in the connective tissue disorders, you can remember this is also integrated topic associated with dermatology. We are going to cover even medicine also. We have conditions like systemic lupus erythematosus, dermatomyositis, and systemic sclerosis. And there are other diseases also, like for example appendageal disorders, that is hair, nails, and various glands are there. So all the conditions related to these. And in the eczemas, we have this patch test which is important, atopic dermatitis, and various types of contact dermatitis is also important. Pigmentary disorders is a very, very easy topic, we can say, where by looking at the lesion, you can easily diagnose this condition. Pigmentary disorders can be hypo or hyperpigmentary disorders. And the genodermatosis, it is very simple. It is genetically acquired conditions which will have dermatological manifestations. So this is a integration with pediatrics and dermatology. And we have neurofibromas and tuberous sclerosis complex, and various malignancies like squamous cell carcinoma, basal cell carcinoma, and malignant melanoma. And other conditions which are drug related like Stevens-Johnson syndrome, toxic epidermal necrolysis, erythema multiforme, which has target lesions. Nutritional conditions like for example pellagra. So I have shown you the Castle's necklace, which was due to vitamin B3 niacin deficiency. The condition is called as pellagra, and various other vitamin deficiencies are also comes under this nutritional disease. And next, we have the most important topic from which you can expect one or two questions in all the kinds of examinations, be it NEET, INICET, or FMGE. So what is this? Sexually transmitted disease. Okay. So we have the syphilis, which is the most important STD, which you must read. Definitely, this must be read. All the points related to syphilis are important. Next, we have genital ulcer diseases in which we have chancroid, chancre, the herpes genitalis, donovanosis, and LGV, lymphogranuloma venereum. And in the genital ulcer diseases, you must remember that how to differentiate and how to treat. Both these are extremely important. Okay. Next, we have urethral discharge, which can be gonococcal or which can be non-gonococcal. And then we have vaginal discharge, which will be covered in your gynecology also. But briefly in dermatology also, you must have an idea what will be the changes, skin changes and skin symptoms. So we have candida, trichomonas, and bacterial vaginosis. And in the genital warts, you can remember the causative agent, and also there are various numericals which were asked in the previous NEET examination. So this is the overview which I want to give you. We have high yield topics which I have already given you. What are they? And if you have to cover dermatology, remember you must cover not just the previous year questions but the previous year topics. Topics are very, very important. And in make your notes, and this is going to help you for last minute revision. Remember, last minute revision cannot be done with the complete notes. You must read it, you must make it concise notes where the points which you forget, the points which are numericals, memory based, are to be written. Some topics may be easy for you, some topics may be difficult for others, but easy for you. Okay, so you must identify what are the topics difficult for you to remember, the memory based numerical or some fancy terms. Write down in a separate notes and use it for your last minute revision. And also you must have a approach where you are going to follow the clinical based approach, and also you must be in a position to answer the image based MCQs. Of course, there will be memory and numerical based MCQs. Like I told, you must write them down in your notes. And you must importantly do mock tests, subject wise tests, and exam and discussion. What is the importance of this? I will tell you in the upcoming slides. And I have made a video regarding this Pareto principle, which is the 80-20 rule. You can check that out. Watch that video, you will understand what is the importance of doing few topics. Okay, few important high yielding topics and the previous year topics instead of covering all of them. Okay, so if you are able to cover the 20% of these high yielding topics, these 20% of the topics are going to give you 80% of the marks. Okay, so that is the Pareto's principle in a simplified fashion. So if you want the complete video, I will put it in the iCard and also a link in the description. You can check that out. And most importantly, do your revisions, and as I have told you, make notes for last minute revision. So these are the success tips. And as a dermatology faculty in the Cerebellum Academy app, I can tell you, I can assure you that if you can cover these previous year topics and the high yielding topics, then most likely you are going to score very nicely in not only dermatology subject. In this video, I am giving you a strategy for dermatology, but even in other subjects also you can do very well. Okay, so what is this balanced approach which you must follow? So in any subject, these are the points, but related to dermatology precisely, I'm going to tell you a few points. So try to cover all the videos whichever are present in the app. So we have the Cerebellum Academy, in which the app is going to cater to all kinds of the students, where there are videos, there is question bank, and also there are previous year questions, and there are grant tests and subject wise tests which are going on. So do the videos and do attempt the MCQs from the question bank, which is going to not only test your knowledge related to that particular subject, it is also a learning tool. Remember, please remember, don't think that this is just a testing tool. It is also a learning tool. Why? Because some points, if you read in the theory or watch in a video, you might not understand or you might not remember. But if you try to answer a MCQ, you are going to get an integrated approach related to answering and attempting that MCQ. So that is also going to help you to learn certain concepts. Okay, so this is the importance of the QBank. And coming to subject wise test and grant test, remember, after completing a subject, if you get subject wise test, most likely you are going to get a good score. But remember what my words, do attempt grant test. If you can attempt the grant test, you will understand that knowing this question, which subject is this question being asked from, also will be difficult in some GTs. Okay, so this I have experienced. Many students told me that this question, whether it is dermatology question or a medicine question, they were not able to differentiate. So that is the beauty of the grant test, in which you do not know which subject, leave the topics in the subject, you do not know sometimes which subject this question is being asked. So this is going to give you a real exam like scenario. Subject wise tests are also important, but giving rank test is extremely important because they are going to mimic the actual exam scenario. So always you must have this balanced approach, which we preach in the Cerebellum Academy. Get the balance right. Okay. So my suggestion would be to cover all the concepts from the videos. But if you are having time crunch, definitely cover the high yielding topics at least. High yielding topics at least. And in the videos, remember basics in dermatology are like your alphabets, the kindergarten topics. Must do topics from the videos. Okay, basics. And these are the other topics I have already shown you. Again, I am showing you whatever are in bold and underline are the most important topics which are must to be covered in the video section. Okay, so coming to the videos, so clinical questions can be there, and there can be integrated approach which we are going to give you so that you can remember for a longer period of time till the exams. Okay, and also image based questions are also going to be covered in these videos. And of course, definitely you can expect the information to be up to date, which is important probably in the infections where the treatment modalities or the investigations might change. So if you ask me, how should MBBS student attempt or approach dermatology? How should a intern attempt the or approach dermatology? How should a post intern approach? These three can be different. Okay, so I will tell you first how should a second, third, fourth MBBS student approach dermatology. Remember, in the first year there are no postings, there are no hospital postings, and the skin OPD postings also will not be there. So coming to the second, third, or fourth year, you have 2 weeks of dermatology in each of these years. So what I would suggest is go to the postings and do see the actual patients. So if you see the patients, if you see the interaction between the faculty and the patient, and if you see the symptoms, the treatment, the investigations which are being performed, good slam examination may be performed in the OPD. If you look at these investigations and the interaction between the faculty and the patients, probably you will remember it for longer duration than just reading or watching the videos, okay, where only theory is being taught. So this is my suggestion for the students who are doing the MBBS right now. So you can see this is the CBME, which is competency based medical education norms. So in which you are having the 6 weeks of the clinics for dermatology, and you are also going to have university examinations in which you can expect a short note probably in the medicine paper coming from dermatology subject. Okay, so this is how the CBME is focused on, and also your dermatology knowledge in the hospital posting is going to help you in the university exam question paper solving skills. And coming to other skills which you must learn, so you can see slit skin smear, skin biopsy, gram staining, KOH, that is potassium hydroxide examination, dark ground illumination, tissue smear preparation, and quackery. So these are some of the concepts which you are going to get an idea when you go to the postings. And these are some of the suggestions for improvement of the course. So this is taken from IJDBL, where the author has given some certain suggestions which are going to be thought about. Probably in the future they might be implemented. And as I told you, if you look at a case in the OPD, because dermatology is a visual branch, it is going to be etched in your memory, in your long-term memory. So this was a patient I have examined, and this is the actual skin lesion where you are able to see fish like scales. So if you know the answer for this question, please leave your answer in the comment section. What is this diagnosis? What is the condition where you are able to see fish like scales? And in your MBBS curriculum, not only the college where you have joined is going to give you knowledge, but also sometimes there will be quizzes which will be conducted by bodies. Like for example, in dermatology, we have this IADBL, Indian Academy of Dermatology, Venerology, and Leprosy, where the quizzes are conducted for MBBS students where interns are not eligible. So if there are these kind of quizzes which are announced, always try to participate so that you are going to gain the knowledge and the interest for the subject, and your thought process about this subject might also change if you happen to participate in this kind of quizzes. Coming to how to approach dermatology for interns. So in the internship, please remember the skin postings are called as minor postings, but yes, do attend the OPDs and the wards. Don't bunk the dermatology postings, and dermatology postings are not to bunk and to read. That is for PG preparation, but they are to see the patients in the OPD, and if you are lucky enough, see the patients in the wards. Okay, why is it important? Because if you happen to join before the PG, if you happen to join as a DMO or as a JR, or even in fact if you have joined in your PG also, there should be some basic knowledge related to the commonly seen dermatological disease. Why is this basic knowledge important? I will give you an example. In foreign countries like US, the general practitioners, general physicians, they are going to treat the common skin conditions. The patients cannot go to a dermatologist directly. They have to go through the general physician. If the treatment from the general physician is not sufficient, if the condition is not getting improved, then they can refer to a dermatologist. Okay, so this is how the practice happens in other countries. So having basic knowledge related to dermatology is very, very crucial, and this can be acquired with the help of looking at the patients, observing them in the OPD, and attending them in the wards. Not only that, the quackery which is happening in India is very rampant. As you can see, this is the combination where you are able to see all kinds of antiparasitic, antibiotic, antifungal steroids are present in one cream, and most quacks are prescribing this to the patients, and patients' skin is being harmed because of these uh, preparations. Okay, so you should learn dermatology so that you are going to avoid these medications, prescribing these medications, and also you are going to educate these patients about the quackery which is going on in India, in Bharat. So these are all the other medications. Any medication which consists of steroids is very, very, we can say, dangerous. It's like a double-edged sword. Only a proper dermatologist, a certified dermatologist, can prescribe these medications, and they are the ones who can prescribe and also monitor these patients, which is very important, and take off these drugs whenever they are needed to be taken off. So these are all the other medications. So you should have a clear-cut idea about these medications. So say no to topical steroid usage. Okay. And in the internship, as I told you, in the wards, you can see some very, very important cases, disease. Like for example, immunobullous disorder, pemphigus, bullous pemphigoid will be admitted sometimes, and the drug reactions, SGS-TEN and EMF can be admitted. So you can observe the lesions, see the treatment investigation which are followed, and you can remember these conditions for your lifetime, not just for your PG preparation. And also pustular psoriasis and erythroderma can also be admitted. What is scar? Severe cutaneous adverse reactions is scars. Okay, so which is nothing but drug reactions. So in the post internship, yes, you have to do revisions, revisions, and revisions. That is the main thing which you must do. And the last minute revision notes which you are going to prepare, and approaching the question bank is also the most crucial thing. And as I've told you, previous year topics and previous year questions are also important. All this can be done with the help of Cerebellum Academy. Okay, so the link for the app, I will leave it in the description below. And if you have any queries related to dermatology, you can easily reach me out through Telegram, through WhatsApp, or through Instagram. All the links I will leave them in the description below. And also you can scan this QR code and you can join. And if you have not yet subscribed to my YouTube channel, please do subscribe to my YouTube channel. And if this video was helpful, please do hit that like button so that the YouTube algorithm thinks that and knows that this is helpful and this is going to be shown to other NEET PG aspirants as well. So this is my YouTube channel. You can subscribe to this. And if you ask me one book which you can follow, you can buy this. Nina Kanma. If you can buy this, you can buy. The link is there. This is a QR code. Just scan this and you can buy this through Amazon. And if you are having this in your library also, just go through the book. In the book, you can see there will be so many images. Remember those images and don't try to ratify. Don't try to batti all the images. Okay, so you should see the image, read the clinical question which is given in the exam, try to correlate, try to complement both these, then come to a final diagnosis, final answer. Okay, so don't just ratify whatever images are there, try to correlate with the question which is asked. And if you want me to make a awesome notes related to dermatology subject which is important for MBBS students, in the comments write down notes, write down notes. And if this session was helpful for you to understand how to approach dermatology, write in the comments thank you DrMSD or thank you. Okay, so that is going to tell that this video was helpful for all the students. So these are the answers for the questions which I asked in the beginning of this lecture. So this is how the dermatology subject can be a visual subject and also a memory based subject and also numerical image based. So all these are present, but most importantly dermatology is an image based subject which is very high yielding, high scoring subject.